right, it's examination time. Oh boy. Alright, so I just had my consult, did all my body, looked at my body, you know, touched everything. We decided we're going to do a liposuction with the body type, so it will help eliminate my fat and skin, tighten my skin, and also fill in my hip dips to give me a more curvy figure, because I have really deep hip dips. And yeah, I'll make sure I highlight it in a little clip so you guys can see. So I'm getting lipo here, and then also a little in my flanks, and this is where the hip dip fill would be, in here. So yeah, if you guys see when I stand, so I can just have a nice natural curve. It'll be complete and tight. I figured I would give like a kind of a brief overview of how my whole experience went thus far for the consultation. Consultation process was so smooth. Everyone, the entire office, I'm gonna say congrats, because I had outstanding customer service in Dr. Aisha Baron's office. I just want to congratulate y'all, because y'all were amazing. You made me feel very secure. You made me feel welcome. I didn't feel any types of nervousness, especially when it comes to dealing with my body. I need to feel safe. Everything was so clean, well kept. The process went so smooth. So I would say in total, my consultation was probably like an hour. I came in, checked in, filled out my paperwork, and then I was taken to the back. I sat down. I got to talk to Dr. Aisha Baron face to face. I told her exactly what I was looking for, and of course she gave me a full, thorough breakdown of the process, what it's gonna be comprised of, how it's gonna go, how long it will take, how my body's gonna feel after. All the things that, you know, I was gonna ask questions about, she was on the forefront answering them. And that's something that I paid attention to, because sometimes doctors aren't as vocal on the process and how it can affect you and what may happen to you later down the line. And I like that. I like the transparency. So she was very transparent. I did ask her about possibly doing something with my little bitties, these things. But I think I'm gonna just wait and hold off, because I think it's best. I'm seeking to, like, you know, make them a little perky and cute, but I definitely think I want to wait until after I have children in future years, not anytime soon. All right, so we go to the next step. This is the examination process. So they give you a robe and then this like little disposable thong panty, just so you can be completely naked underneath. Then after a few minutes, Dr. Baron will come back in and do the examination. So she's gonna like she was just touching on my skin to see how my skin would hold up for the surgery. Also looking at exactly where I wanted to modify my body when it comes to doing the liposuction, and also where I wanted to have the fat transfer placed. After this, I was taken into a room right next door where we take my before pictures, 360-degree pictures, completely naked, which was interesting. So after the examination process, I was able to put my clothes back on, and then a representative came in and she spoke to me about the procedure quote. In a nice way, a procedure quote is just how much it's gonna cost. So let's talk the cost of this surgery. I got two different quotes. Now, the final step has come. Paying for the procedure. To lock in the procedure, I had to put $1,000 down. This is just to hold my spot and so I can get a surgery date. Now, the next step is choosing the two quoted options. So my first option is to have the procedure done in office. If I have it done in office, I will not go under full anesthesia, and I will instead have a laughing gas to calm me down, also to help with the pain management. And doing this makes the procedure a lot less costly. I mean a lot less costly, like almost $3,000 less costly. So please keep this in mind when you're doing your procedures. I know I have the option of 1, doing the in-office, or 2, if I don't want to do the laughing gas and I want the full anesthesia, I would have to do it in a hospital. So doing it in the hospital, not only will I have to pay for the anesthesia, but I also will have to pay for the facility fees. So yes, it made a huge difference. The facility fees and the anesthesia makes a huge difference when it comes to the difference between doing it in the office, at Dr. Aisha Baron's office, or to doing it in a hospital setting. These are things to keep in mind. Do you want to be awake for your surgery, or do you want to go to sleep? For me, I believe I'm going to be just fine when it comes to the pain management. I have a very high pain tolerance, hence the tattoos. All right. Because of my high pain tolerance, I am actually going to do the in-office. Pray for me. I really don't think I need the full sleep experience. I really don't care to really go to sleep. At first I was like, oh, this is gonna be kind of crazy. Now I'm like, okay. I was able to actually speak to another lovely lady in office who worked for Dr. Aisha Baron, and she had the surgery awake, the same exact surgery I was gonna get. So that made me feel much more reassured that I'm gonna be fine. All right, so my FUPA funeral is September 9th. Yes, I'm calling it the FUPA funeral because the FUPA will be gone. So this is a birthday gift to myself. My birthday is actually October 8th. So let's just pray that I'm not sore, okay? All right, let's talk money. So please keep in mind, this is a disclosure, that your procedure costs or your procedure quote may be different from my procedure quote. This may be just based on whatever you're getting. So remember, please keep this in mind. My procedure quote for the in-office, which of course, this is the one with laughing gas, and I would not be under full anesthesia, is going to be rounded at about $9,300. $9,300. I'm trying to say this in a nice way because I'm just about to spend a lot of money just so I can have some little boop. Option number 2, which would be going into the hospital and having the full anesthesia. Now this quote is going to be at $11,400 roughly, if we're rounding up. Now, $9,300 versus $11,400. 2 different prices, okay? If you're gonna embark onto this journey, keep in mind when you're given the option, you definitely gotta have this choice. I like the fact that I had somebody to talk to about the options, because everyone was saying that, if you have the option to do it in office, just do it in office. It's so much easier, so much more pleasurable. She actually has an office of all women staff, which makes me feel much more safer as well. Now, nothing against men, but for me, when it comes to like anything in a medical setting, I just feel a little bit more comfortable when I'm out around on all women staff. So yeah, so stay tuned to my journey. This is going to be a very interesting experience, but I'm actually really excited for this. So I've been wanting this procedure for a very long time. Now that I'm in the limelight and I'm doing modeling and I'm doing this and that, now that I'm in the limelight of the internet, I just wanted to be as transparent as possible because I'm definitely about to come back, snatch this And I want to make sure that I'm being transparent that, yes, I do work out. I work out regularly. However, I wanted to just show y'all that it's okay to just do what you want to do. Just because I'm moving the check-ins to the savings doesn't mean it ain't real, baby.
Okay.
Stay tuned. This is going to be a wild one. I'm interested in how this surgery process is going to go. I'm definitely going to keep y'all updated. Thanks for watching.